B1617 virus variant that was first identified in India. Indeed, this is one that has been classified as a variant of interest by WHO. I assume you're talking about the B1617 virus variant that was first identified in India. Indeed, this is one that has been classified as a variant of interest by WHO. Over the weekend and last week and into today, our EPI team and our lab team has been discussing with our virus evolution working group this variant, this B1617, and everything that we know about it in terms of transmissibility and any studies that are being done in India as well as in other countries where this virus variant is circulating. It is important to note that this lineage, this B1617, has 3 sublineages, the 0.1, 0.2, 0.3. I won't go into that level of detail. All of that will be provided in our SITREP tomorrow, where we will outline all of the information that we know about each of those sublineages. Having said that, in consultation with our virus evolution working group and our EPI teams and our lab teams internally, there is some available information to suggest increased transmissibility of B1617. What we do want to say is that even though there is increased transmissibility demonstrated by some preliminary studies, we need much more information about this virus variant in this lineage, in all of the sublineages. So we need more sequencing, targeted sequencing, to be done and to be shared in India and elsewhere so that we know how much of this virus is circulating. We don't have data yet on diagnostics, therapeutics, and vaccines. But we don't have anything to suggest that our diagnostics, our therapeutics, and our vaccines don't work. This is important. We will continue to see variants emerge. We will continue to see variants of concern around the world, and we must do everything that we can to really limit the spread.
Today, the WHO Foundation is launching the Together for India appeal to raise funds to support WHO's work in India, including the purchase of oxygen, personal protective equipment, and medicines. To donate, go to who.foundation and look for the black Donate button and select the Together for India appeal. Globally, we're still in a perilous situation. The spread of variants, increased social mixing, the relaxation of public health and social measures, and inequitable vaccination are all driving transmission. Yes, vaccines are reducing severe disease and deaths in countries that are fortunate enough to have them in sufficient quantities. And early results suggest that vaccines might also drive down transmission. The shocking global disparity in access to vaccines remains one of the biggest risks to ending the pandemic. High and upper middle income countries represent 53% of the world's population, but have received 83% of the world's vaccines. By contrast, low and lower middle income countries account for 47% of the world's population, but have received just 17% of the world's vaccines. Redressing this global imbalance is an essential part of the solution, but not the only part, and not an immediate solution. We cannot put all our eggs in one basket. We have many vaccines for many diseases, but for each of them, we still need a combination of vaccines and public health measures. The same is true with COVID-19. Vaccines prevent disease, but we can also prevent infection with public health tools that have been so effective in so many places.